Last May, I announced that our government had approved an exemption request from the province of British Columbia so that adults 18 years and over in the province found in the personal possession of up to 2.5 grams of certain illegal drugs for personal use would not be arrested, criminally charged, or have their drugs seized. Tomorrow, that exemption comes into effect, marking a monumental shift in drug policy that favors fostering trusting and supportive relationships in health and social services over further criminalization. Through this exemption, we will be able to reduce the stigma, the fear and shame that keep people who use drugs silent about their use or using alone, and help more people access life-saving supports and treatment. As we were clear last year, this exemption is not legalization. All activities with illegal drugs, including production, trafficking, import, and export, remain illegal, even if conducted with the drugs listed in the exemption in amounts under the 2.5 grams threshold. I will also assure you that since announcing the exemption, our government has been working with British Columbia as they put in place measures to support successful implementation, including law enforcement guidance and training, and increasing the health and social service supports. Together, we will work closely to evaluate and monitor its implementation to ensure that this exemption continues to meet public health and public safety objectives, and to help inform Canada's comprehensive approach to address substance use harms. Although we still have a lot to learn about the impacts of decriminalization, it is our collective hope that this exemption will help reduce the stigma related to substance use, increase the access to health and social services, and decrease the harms related to criminalization, and ultimately save lives.
Decriminalization is a historic change, but we know it will not solve the toxic drug crisis on its own. This is one tool in the province's fight against this ongoing public health emergency. Through historic investments, we're continuing to build a system of mental health and addictions care that works for all British Columbians. That system includes prevention and early intervention, enhancements across the full spectrum of treatment and recovery, as well as expanding harm reduction measures. Since 2017, our government has opened more than 360 new substance use treatment and recovery beds in all parts of BC. And in March 2020, we introduced prescribed safe supply and then expanded that again in July 2020 and are the first province to do so in Canada. We're also expanding access to harm reduction measures, such as expanding overdose prevention sites from 1 in 2016 to 42 today, expanding naloxone and medication-assisted treatment, among other measures. And we know that all of these measures are saving lives. We've added thousands of supportive housing units, brought in the first of its kind complex care housing with 500 units on the way for people with complex mental health and substance use challenges. And we're doing more. And we know we need to do more. We're building a system of care that British Columbians need and deserve. Decriminalization is a crucial part of that system. It will help break barriers and create pathways for more people in our province on their pathway to wellness.
Today's announcement is an important step to help remove the fear and the shame and that stigma, and allows people to have open conversations that we can help people understand their drug use and reach out for the services they need. We hope this will help people feel safer about getting those life-saving services and programs and talking to their friends, talking to their healthcare provider, and help our healthcare system in keeping people alive and connected to the health and social supports they need. It will not be perfect, and it's not going to change the crises that we're dealing with overnight, but it is a philosophical and an important step that helps us take that next work together to make sure that we are doing everything we can, and that there are many different streams that people can follow. We will be adjusting as we go, and I know there's lots of questions about details and what data we're following and how we're going to measure this and the 2.5 grams. Those are all the things that we will be working together to follow, to understand the impacts on public safety, to understand the impacts on people in our communities and our families across this province.
Addiction and substance use are healthcare matters. Police in BC support the decriminalization of small amounts of illicit drugs for personal use to reduce stigmatization, direct individuals to pathways of health, and to avoid criminalizing people who use drugs. Decriminalization is a significant step towards making our drug policies more progressive. And it recognizes that substance use is a health and not a police matter. Police can now focus on those doing the most harm in this crisis: persons and organized crime groups who import, manufacture, and distribute these toxic substances. We're proud to be here today with our partners to celebrate this milestone achievement in drug policy. At the same time, we recognize that much more work still needs to be done to address the magnitude of the toxic drug crisis and its impact on communities. We look forward to working with our partners on additional measures to combat the toxic drug crisis, including access to safe supply and better connecting people who use drugs with social, health, and treatment services.
We know from the implementation of decriminalization in Portugal, benefits included reduction in the social harms of drug use, reduction in the transmission of HIV, reduced demand on criminal justice services. In BC, decriminalization will reduce stigma around drug use. And because the fear of drug confiscation is removed, people will be more inclined to seek vital substance use care and other health services they so often need. This includes improving access to options on the harm reduction end of the continuum of care, like we offer at Providence Healthcare's Crosstown Clinic. Having daily access to health professionals, as Crosstown patients do, is a great opportunity to provide comprehensive care and help them move along their recovery journey at their own pace. Decriminalization supports patients' autonomy to choose what care is right for them. It provides options for conversations between patient and care provider about their goals, whether they are seeking life without opioids or they are seeking something that is more consistent with harm reduction. I support decriminalization. And I welcome the security and stigma-free access to care it will potentially give individuals. It will improve lives. I thank both levels of government, provincial and federal, for this important change. I believe decriminalization will amount to a sea change in the public health approach to drug policy and to the care of individuals, people who use drugs.